Cardiovascular Drugs Part 3.
Antihyperlipidemic agents. Note that there is a background change color. Um, the newest guidelines from the American College of Cardiology, American Heart Association, do not recommend using specific cholesterol targets or like the numbers that patients would think of for deciding treatment for these patients with higher cholesterol levels. The focus is more on the patient's estimated 10-year arterial sclerotic cardiovascular disease risk. They would recommend more lifestyle modifications, including like a cardiac diet, heart healthy diet, regular exercise, avoiding tobacco products, maintaining a healthy weight, and a good, waist to hip ratio remains the basis of that lowering of the lipid levels. The statin drugs, I'm going to refer to them as statin drugs, although there's a big, huge name associated with them, are the drugs of the first line of defense for arteriosclerotic cardiovascular disease. The statin drugs, for instance, example, lovastatin, Mevacor is the example of one of these types of drugs, is used to lower or inhibit the cholesterol level by the reductanase or inhibitor, eliminating the enzyme in cholesterol synthesis. I'm not really asking you to memorize that, but I just want you to know specifically that the statin drugs are the first line of defense. And if you look at your exhibit in the appendix, I think it's Appendix A that I talked about in Module 1, these types of medications, there are several of them in the top 20 most commonly prescribed medications, so you will come across these for your clients frequently. The statin drugs' adverse effects are GI complaints such as stomach ache, constipation, diarrhea, and gas. Other side effects are myositis, skin rash, impotence, hepatotoxicity, which is important, blurred vision, and lens opacities. You want to be aware of a client taking this medication, especially because there's an increased anticoagulant effect of Warfarin. Another drug classification are inhibitors of intestinal absorption of cholesterol. Most commonly, drug that you'll see is the Zetia, and these can be in combination drugs. They're currently used together. It's easier for a patient to take one medication rather than two different pills to treat cholesterol from two mechanisms of action. The Zetia, I'm not going to pronounce the generic name, decreases total cholesterol, LDL cholesterol, and increases the HDL. Remember that the LDL is the lousy or the bad cholesterol, L lousy, and HDL, which is the good cholesterol, the one that you do want increased. This fixed dose combination lowers the LDL level more than a statin drug would alone. Side effects include fatigue, abdominal pain, and diarrhea. Yummy. Your niacin drugs, sometimes patients will refer to them as vitamin B. In large doses, it lowers cholesterol levels by inhibiting the secretion of the very low density lipoproteins without accumulation of triglyceride in the liver. This reduces the LDL synthesis, the lousy cholesterol synthesis. At these large doses, niacin commonly produces some cutaneous flushing, feeling of warmth, hot flash type of sensation, and this can be blocked by the patient taking aspirin or ibuprofen prior to the administration of the niacin. Hyperuricemia, allergic reactions, cholestasis, and hypotoxicity have also been reported. I want you to pay special close attention to the problems with the liver, the hypotoxicity. Also, keep in mind that this can cause orthostatic hypotension, so be very conscientious when you are lowering and raising the dental chair. Fish oils. You might see clients taking a fish oil, either self-prescribed or physician-prescribed. They help to eliminate the triglyceride in production and increasing the clearance of it. Adverse effects of the fish oils include belching, unpleasant fish aftertaste, and worsening of glycemic control in diabetic patients. So be very conscientious for a client who's both diabetic and taking a fish oil. They may not know the contraindications of those two medications together. Dental implications of a patient taking the anti-hyperlipidemic drugs. You want to be very careful to handle a medical emergency. Most often these patients are at highest risk for both MIs and cardiac arrest. Monitor their blood pressure, both the rate and of their pulse and the blood pressure before each appointment. Because a lot of these medications have effects on their GI and liver abnormalities, you want to keep in mind that if any other drugs are prescribed or recommended, that you check to be sure that there's no tolerance to the agents that are going to be prescribed. Small possibility of abnormalities of the medications in reference to their liver function, those should be, the patient may need to have some liver testing done, but those are only in extreme cases. Another drug, anticoagulant, this one is a direct thrombin inhibitor. You probably have seen commercials for it. Pradaxa is used for the prevention of stroke, systemic embolism, and it's indicated also for patients with non-valvular AFib. And I know we talked about the arrhythmias earlier in this lecture, but this, along with other anticoagulants, is used for that treatment. This drug directly prevents the clot from forming in the body, and the side effects that occur are GI in nature and an increased risk for bleeding. Plavix is used for clients who cannot get a good therapeutic index for the Coumadin. It induces platelet aggregation, results in prolonged bleeding time. Indicated for clients with recent history of MI or stroke and with established peripheral arterial disease, and for patients with some sort of a coronary artery syndrome. Side effects include thrombocytopenia purpurea and increased bleeding. Okay, I changed the color of this background, although I did group these two drugs with the anticoagulants. These are drugs that increase blood clotting, and sometimes they're used after surgery for patients that are taking some sort of an anticoagulant. The EACA and cycloproprin are used for to increase the blood clotting. Adverse effects are intravascular thrombosis, hypotension, and abdominal discomfort.
Dental implications, like I said, about calling, checking with the physician. And again, we'll talk about this a little bit more in DH3. Those clients who are on, who have a prosthetic heart valve, would need an INR level between 2.5 and 3.5. If the level is above 3.5, you might want to see if that can be adjusted for scaling and root planing. However, I would definitely check with their physician regarding that. Atrial fib, those clients are usually between 2 and 3. Dental interactions is that you want to be careful with aspirin because it increases the bleeding. Use, acetaminophen or opioids for pain control. You want to also be careful with antibiotics because it reduces the flora in the GI tract, reducing the synthesis of the vitamin K. Use clindamycin or amoxicillin, which have a small effect on it. One pre-med dose if the client needs to be pre-medicated because they have, prosthetic valve. That's not detrimental to the client's INR value. Phenobarbital reduces the Coumadin effects because it increases enzymes that will destroy anticoagulants.
This is the end of Part 3 of Cardiovascular Drugs, Module 4.